your forecast first. Sponsored by Matex Heating, Cooling, and Plumbing.
Take a look at the Storm Tracker Doppler tonight, and not a whole lot going on. It's nice and calm. We're hoping it stays that way, but we don't think that is going to be the case all night long. But there is a little bit of a break after the storms we had earlier this afternoon that moved through. Nothing severe, which was good. But boy, is it warm. It's humid out there. Temperatures back to the upper 70s today. We flipped the switch. And after just a couple days ago when we had frost outside, we're near 80 degrees. Okay, thunderstorm chances going to be ramping up here, especially after 8 o'clock tonight. We'll talk more about the severe weather threat that could go along with that when we come back. WCIA 3 News starts right now.
Now from WCIA 3 News.
It's no secret that people are, they're making money on unemployment that may be paying them more in some instances.
Hundreds of thousands across the state have found themselves unemployed. But is that necessarily a bad thing for everyone? Plus, the Christie Clinic Illinois Marathon had to be postponed. What officials are now saying about its future.
That there are no clear black or white answers.
COVID-19 death toll continues to rise in Illinois, but are those numbers accurate? A Target 3 investigation gets some answers.
You're watching your local news leader. This is WCIA 3 News at 6.
We're definitely seeing people refusing work right now.
At the same time, the state has processed more than 1 million unemployment claims since March 1st. Good evening, I'm Jennifer Roscoe. Thousands are out of work during the pandemic, and while unemployment is a nightmare for some, for others, it has benefits. WCIA 3's Courtney Bunting has more.
Right now, 1 in 5 people in Illinois say they're out of work. But despite those numbers, some say it's been difficult getting people to re-enter the workforce. Melissa Wilhelm is the marketing manager with Manpower. They help pair people up with jobs. She says finding people to fill positions is getting much harder.
We do have work available, and we work with very good essential business clients that are really looking for people right now, and it has been a challenge for us to put those people to work more than I've ever seen in my life, actually. Whether that is a combination effect of A, fear, or B, that they are currently getting unemployment.
That unemployment deal is a little sweeter now than usual. While state unemployment usually pays 47% of someone's weekly wages before being out of work. The $2 trillion federal stimulus bill passed in March is now adding $600 on top of that.
It's no secret that people are, they're making money on unemployment that may be paying them more in some instances than some of these positions that we're offering.
But it's not all coming up roses. Assistant U of I professor Eliza Forsyth says health insurance premiums can take away from most of that difference.
Until we have a control over the pandemic and until employers are hiring again and people feel safe going out and visiting businesses again and spending money again, right? People are basically, the whole economy is just kind of on hold.
While jobs may not be as prevalent as before, Wilhelm recommends trying to get your foot in the door as soon as you can.
So people would be smart, in my opinion, to go ahead and get a job now before all of these folks are looking for work, and clients will be that much pickier, in the people that they're choosing.
Reporting, I'm Courtney Bunting, WCIA 3, your local news leader.
Another concern for people returning to work is childcare. A lot of parents either rely on schools or daycares. And with both of those closed now, they may avoid getting a job. The state is doing something different to help the unemployed. They've launched a new website, Get Hired Illinois. It's a one-stop shop for both employers and those looking for work. There are currently nearly 60,000 jobs posted. The website will also have career training opportunities. We have a link to it on our website, WCIA.com. The CU Public Health District is asking all essential workers, symptoms or not, to be tested for COVID-19. With a growing number of cases in the county, they're looking at workplaces. The health administrator says the county now has more testing materials available than when the outbreak started. She says they are monitoring several workplaces in Champaign County with outbreaks, that is anywhere with 2 or more cases. We have new details on a St. Joseph gym that opened its doors. The Champaign County State's Attorney has placed a temporary restraining order on the business. It was signed by a judge and the Public Health Department. Now the business is closed. About a dozen people were working out at the zone at the time and had to be escorted out. The two sides will meet with the judge a week from today to talk about the future. We have an update on the number of cases at Rantoul Foods. So far, 83 employees have tested positive. Health officials say they are still testing the 700-some workers there. Along with testing, U of I staff members are looking over the floor plans and taking samples at spots around the plant to test for the virus. There are 11 new cases in Champaign County. That brings the total to well over 300. More than 170 of those have already recovered. There are more than 3,000 new cases of coronavirus in the state. That makes almost 88,000 overall in 99 counties. 138 more people have died in the last day. We are near 4,000 deaths in the state. But not everybody in that group tested positive for COVID-19. In fact, our Target 3 investigators found some of those who died actually tested negative. WCIA 3's Mark Maxwell has details.
The first COVID-19 related death in Illinois. 3 more deaths.
13 additional deaths.
53. 125.
192 were reported in the last 24 hours.
As Illinois' daily COVID-19 death toll continues to rise, so do questions about the accuracy of those numbers.
I know some people have had concerns about the number of COVID-19 deaths that have been reported. Some are concerned that the numbers are inflated.
Public Health Director Dr. Ngozi Ezike addressed those concerns Tuesday.
At IDPH, trying to remove those obvious cases.
She says if someone tests positive for COVID-19 but dies in a car crash or shot to death, the state removes that person from the death count. What's harder to determine is the precise cause of death for patients with coronavirus and cancer or lung disease or some other underlying condition.
That there are no clear black or white answers. Everything is in shades of gray.
That gray area is where coroners come in and in many cases give their best opinion, even when hard facts are hard to come by.
Then this section here is the cause of death section.
CDC instructions list 3 categories on a death certificate: immediate cause, underlying causes, and other significant conditions contributing to death. Champaign County Coroner Dwayne Northrup says all 3 categories are technically considered COVID-related deaths.
Probable or presumed, if that's listed on the death certificate, a lot of times that's because the person had symptoms that were consistent with COVID-19, like a fever, cough, but the person was not able to be tested before they died.
You can put probable COVID on something that looks like COVID.
In McLean County, Coroner Kathy Yoder saw one case where symptoms looked similar to the coronavirus, but when the patient was still alive,
his test came back negative.
And after he died,
Dr. Denton and I, who's my forensic pathologist, we discussed this, and he was the one who wrote down probable COVID and said this is what I would go with.
That patient tested negative for COVID-19, but still wound up in the state's overall death toll, raising the question, how many other patients might have also tested negative or never taken a test at all?
A lot of the deaths are being certified by the physicians in the hospital.
Pulmonary specialist Dr. Manjeshwar Prabhu treats patients with lung problems at St. John's Hospital.
How do you know that patient died of the coronavirus?
We don't. We don't actually know that that patient died of coronavirus, which is why they've got a sort of a subclassification called a COVID-related death.
He says even if medical experts don't quite know how patients with coronavirus die or precisely what kills them, they know patients are in fact dying, and the coronavirus plays a major role.
Oxygen is really the fuel for our body. So without good oxygen, your heart doesn't work right, your blood pressure doesn't work properly, the brain doesn't work properly.
That was Mark Maxwell reporting for us. We asked the Public Health Department how many of the 3,900 deaths in Illinois actually tested positive, or how many were based on assumptions from doctors or coroners. They have not yet responded. Dr. Ezike has said more than 90% of those deaths also had other underlying conditions. The governor is moving along with his regionalized Restore Illinois plan, what some lawmakers see as the biggest problem to it. And also tonight.
It's very sad, but it's for the right reason.
It's one of the biggest weekends of the year. What it means to have no Illinois Marathon.
And tonight, the clouds are out there, but it did warm up quite a bit today. We had a few thunderstorms. That's the Roofing Doug at Bradshaw Weather Camera, where we recap today. Temperatures made it into the 70s. Back to normal. We've got some strong storms in the forecast tonight. Could see some heavy rainfall, and we'll talk about the flood threat that could go along with that as well coming up.